Teaching the topic of HIV/AIDS can be quite a challenge to any teacher or counselor. The following skills have been shown to be quite effective. Chaining. This is teaching one step in a skill at a time and in a set order. For example, we would first define HIV/AIDS, then discuss where it is found, then how it is transmitted, and how it can be prevented. Shaping. This is teaching a skill by reinforcing behaviors that appear closer to the desired skill. For example, teachers can identify high-risk sexual behaviors and reward each social skill that depicts behaviors that are not risky. Generalization. This is learning to use a newly learned skill in whatever the situation. For example, empathy, negotiation and decision-making skills can be used in many risky situations related to HIV/AIDS. A lesson plan for showing these skills. The topic: using empathy and support for people living with HIV/AIDS. Teachers can achieve several objectives. They can assist students in understanding the concepts of stigma and discrimination, while at the same time learning how to demonstrate empathy to people living with HIV/AIDS. Teachers and counselors can engage students in a discussion using a series of photos while asking the question, do you think this person can become infected with HIV? Teachers can also then ask, can you become infected with HIV? This discussion should lead to a clear understanding that anyone can become infected with HIV. Teachers can then ask, how would you like to be treated if you were infected with HIV? Reward each positive response. Discussions like these facilitate great role play and group work. Students can then be given a story or passage illustrating the topic and be placed in groups of no more than 5 to read, discuss, and answer questions based on everything taught previously. After this exercise, students can regroup. This is the perfect opportunity for the teacher to emphasize the steps for showing the critical life skill of empathy, such as ask the person to talk about how they feel. Share your honest feelings. Give support if needed. Offer encouragement. Be available to listen and talk.
Today in the audience with us we have Dr. Pereira.
In this segment of the show, we'll be talking to the expert and we'll ask her some questions, and our audience members have the opportunity to ask her some questions as well.
What is the difference between HIV and AIDS?
Okay, thank you, Denver. Thank you, Denisha.
Oh, you're welcome.
Now, it's very important to define the terms HIV and AIDS. HIV stands for human immunodeficiency virus. AIDS stands for acquired immunodeficiency syndrome. Now, the main difference is that someone, when they contract the AIDS virus, the virus which causes AIDS, they're said to have the virus. It becomes AIDS when the person becomes ill. And the person may become ill with certain symptoms such as weight loss. They may have a fever for more than 1 month, and they may also have diarrhea which lasts for more than 1 month. Okay. So you can have the HIV virus but not have AIDS.
Okay.
But once you have AIDS, you've gone beyond that level of having the HIV virus, and now you've now progressed into what we call the symptomatic stage of the disease condition.
Okay.
Dr. Pereira, I've heard about the term opportunistic diseases. Could you explain it to me, please?
Yes, Denisha. Opportunistic disease or opportunistic infections, as the word clearly means, it means an opportunity. Now, normally, the way each one of us is made is that our immune system functions very well. In the atmosphere, there's a lot of germs, bacteria. Even now we're talking, there are bacteria, foreigners, viruses, funguses. and we have the skin to protect us. So once we're exposed to any virus or bacteria, our body's immune system, which comprises mainly the white blood cells, would rush to that area of the body and get rid of that bacteria or virus or fungus, even chemicals. Now, what happens in HIV/AIDS is that the virus itself, it prevents our immune system from working properly. So when we are exposed to an infection, say a common cold, we don't have the amount of white blood cells to fight off that attack. So we get all the symptoms. We get fever, we get the congestion. It becomes much worse.
What actually spreads AIDS?
Yes. Okay. Well, AIDS is basically caused by a virus. Okay, and a virus is a very small microorganism. We can't see it. We have germs, and you can have bacteria, you can have viruses and fungus. Now, the one that causes HIV is called a virus. It's a retrovirus. It's a type of virus. It's a very small virus, and it can be spread in several ways. You cannot get AIDS, for example, in sitting in a room with someone who has AIDS. You can't get AIDS by hugging a person or kissing on the cheeks or sharing a meal with that person. But the main route of transmission of the AIDS virus is by sexual contact with a person. For example, we know that the AIDS is found in the blood. So if someone who has AIDS has sex with someone who doesn't have AIDS, the person can pass on the AIDS virus, because you can have the AIDS virus in the semen. Okay? So the main contact is by sexual intercourse. AIDS can also be spread from mother to child, because while the child is developing inside the mother can send some of the viruses, if she has it, to that child. Also, during the birth process itself, the mother can send to that baby the virus, and breastfeeding itself also, the virus can be sent to the child. HIV can also be spread by injecting, using dirty needles to inject. For example, if someone who has HIV/AIDS uses a needle and they inject themselves, some of their virus remains in that syringe. So when somebody else uses it to inject themselves, they also inject some of the virus, and they can get HIV/AIDS that way.
I heard that you cannot catch AIDS by kissing someone. Is that true?
Well, it depends on the type of kiss, Denisha. Do you know of any types of kiss?
Yes, I do. You can kiss you can kiss someone on the cheek, or what we know as French kiss.
Okay. When you kiss someone on the cheek, that's called a dry kiss. And the French kissing in the French kissing, there's actually an exchange of body fluids or saliva. Okay? And the French kissing, in French kissing, somebody who may have AIDS, they may excrete some of the virus also in saliva. But the amount of virus in the saliva is not sufficient to cause that person to contract the AIDS virus. However, if the person you're kissing has an open sore in the mouth, then that can be quite dangerous, because some of the virus can get into the body via the sore. So French kissing among people is not advised. Okay, but dry kissing alone, hugging, I can hug you, kiss you like this, we won't contract AIDS that way.
Can you get it from a mosquito?
Well, then, but that's a very important question, because as you know, we live in the tropics, we live in warm areas where we do have a lot of mosquitoes, and a lot of research has gone into that area, and it has been found that insects, mosquitoes cannot transmit the AIDS virus.
Okay.
This may be because even if they bite someone who has the AIDS virus, when the virus enters their body, they have like chemicals and enzymes in their saliva that can deactivate the virus. So they're not able to pass it on to another person. Okay, so mosquitoes do not transmit the AIDS virus.
What types of treatment are there available for people with HIV and AIDS?
Yes. Well, what I'd like to say first of all, Dinesh, is that there's no cure for AIDS. Once a person has contracted the HIV virus, there's no medication that we can give them to say, well, I'm going to give you this medication and it's cure AIDS, you won't have AIDS again. Okay? So once you have it, we can treat it though. So we can treat this, the symptoms. Now, the medication used to treat HIV/AIDS is called antiretroviral treatment. And this treatment basically involves the use of three or four different types of medications. Now, the terms might be a bit technical. What they're called nucleoside inhibitors, protease inhibitors. They have about 20 different types of medication on the market now that can be used. And what the medication does, once the virus is in the body, it prevents, some of them prevent the virus from reproducing inside the blood cell. Some of them prevent the virus from traveling to different areas of the body. So, and this way they keep the amount of virus in the body, the number of virus in the body low. So when you have a low viral count, your immune system is able to work properly. If you have a lot of virus in your body, it can break down and damage your white blood cells, because the virus likes to live in the white blood cells, a certain white blood cell called a CD4. That's the one that it destroys. Okay, so what these antiretroviral treatment, how they work is that they prevent the virus from replicating and spreading in the body.
We have a question behind here.
Okay, good afternoon.
Hi.
I have two questions. First question is it true that our body can digest HIV infected blood without us contracting the disease?
Okay, you mean if you eat blood, the body can digest it
without getting infected?
Okay, what happens? Suppose you ate something, and let's say the virus was in it.
Yeah.
Okay, saliva from a person, you ate it, saliva was in it. What happens? Inside your mouth, we have saliva and we have enzymes that can deactivate the virus. Even further down in the gastrointestinal system, in the tummy, there's a certain acid called hydrochloric acid. Okay, and that acid is meant to break down things like bacteria and viruses. So the only way that you can get an infection that way is if you have like a lot of ulcers in your mouth, and even then the virus would enter your body through that to get to the bloodstream. You can't really say eat something and you get the virus. As I said, it can be transmitted sexually, from mother to child, transmission from intravenous drug use, those sort of ways. But you can't eat and get the virus.
Yeah. Question number two. I heard that I don't know if it's true or false, but I heard that it's easier for a woman to contract AIDS than a man.
You're very good. Yes, that's very true. And the reason for that is the way the body is made. The woman's body is like a receptacle. Okay? And so in this way, it's very easy for the woman to get the AIDS virus, much easier than a man's body, just because of the way the body is made, like a receptacle.
What complication would a baby have when born with HIV virus?
Okay, that's an excellent question. Now, these days, when a lady gets pregnant, even here in Antigua, that lady is offered the AIDS test. And if the AIDS test comes back positive, then we start her on the antiretroviral treatment right away. And that cuts down dramatically the chances of her passing on the AIDS virus to the baby. But let's say suppose she has the AIDS virus, she doesn't know, she doesn't get the treatment, and the baby is born and it has AIDS. One of the first symptoms the baby would show is something called failure to thrive. So in other words, the baby would always be weak, crying, it won't put on weight. You find that the baby would have a lot of infections, like a lot of skin rashes, or like the skin is peeling off all the time. And the baby would be in a lot of pain. The baby would get like a lot of chest infections, a lot of cough and pneumonias. He would have a lot of diarrhea, vomiting, meningitis, lung infections, skin infections, kidney infections. So you'd notice right away, hey, something is wrong with this baby. Okay? So a baby who is infected with HIV/AIDS from birth may show the symptoms. On the other hand, you may also have some babies whose immune system may work better and may not show as many symptoms, but they'd always be malnourished and undernourished. So you notice that something is wrong.
Okay, well, there you have it. True or false? Can someone catch AIDS if an infected person sneezes on them? Will you get it?
You're right.
Okay, true or false? Can a woman who has HIV pass it on to her baby? True. She can pass it on during pregnancy, childbirth, or breastfeeding.
Okay. The human immunodeficiency virus is the virus that causes AIDS. True or false? I didn't hear you.
I did not hear you.
True or false? Okay, that's true. That's true.
True or false? An infected person can still work and play normally. Good. Thanks.
Okay, true or false? AIDS is acquired immunodeficiency syndrome. Yeah, that's true.
True or false? Having AIDS is the same as having HIV. Which one is deadlier? AIDS. Good.
AIDS is deadly?
Yes.
For real?
Yes.
How come nobody tell me?
You were listening.
Okay. True or false? A person. Wait for the question. Wait for the question, aye? A person who is not gay does not have to practice safe sex. True or false? You sure? Yes. You peep? Yo, hey, the peep. Yo. Okay, that's false. Anyone who has sex without a condom, no matter if you're gay, what are some?
Straight, bisexual,
Bilingual, by the riverside, by something or the other. Once you don't have sex with a condom, you are at risk of getting AIDS.
Okay. True or false? Alcohol and ganja puts a person at risk of catching STDs or HIV. Which one is it? True or false?
Okay, wait. You seem like this guy over here is brighter than everybody else. Is it true or false, guy? No, you man, why you look so far? It's true.
That's true. Under the influence, they may be more careless and have unsafe sex.
Here are some skills you can use to protect yourself from becoming another HIV/AIDS statistic. Refusal skills. Use the word no in your refusal. Emphasize your refusal by repeating it in a clear, strong voice, making eye contact, and do not smile. Let your body language also say no. Walk away. Give reasons for refusal or list possible consequences. Suggest an alternative that includes your friend. Change the subject or walk away. Problem-solving skills. Stop. Check out the scene. Think. Be aware of the choices and consider the consequence. Act. Choose the best alternative and act on it. Review. Decide whether the action has helped or hurt. Decision-making skills. State the problem. Examine the consequences of the problem. State your desired objective. Examine all alternatives. Make a decision. Negotiation skills. Refuse the behavior in a positive, assertive way. Explain why. Provide alternatives. Talk it out to reach the desired outcome. This teaching tool is sponsored by CEDA.